Unit 6, Special Needs Students. At the conclusion of this unit, you will be able to identify physical and cognitive neurological conditions that influence a student's ability to learn, understand the causes and impacts of these conditions, and implement strategies to accommodate students with these conditions. As instructors, you may encounter students with special learning needs. This lesson is a brief overview of some of the more common conditions influencing the way hunter-trapper education students learn. At the end of this lesson, you will have a greater understanding of what these conditions are, how they are caused, and how to accommodate them. The conditions that are covered in this lesson generally fall into two categories: physical and cognitive neurological. We're going to first look at the physical conditions. These are conditions that affect a student's ability to gather information or inhibit participation in learning activities. These areas include vision, hearing, and mobility tactile function. First, we will cover vision difficulties. These conditions include color blindness, nearsightedness, also known as myopia, farsightedness, hyperopia, and total blindness. Color blindness. Color blindness may be hereditary or caused by disease of the optic nerve. Photoreceptors called cones located in the center of the retina are responsible for color perception. The cones contain three photosensitive pigments: red, green, and blue. Defective color vision is a result in a deficiency or absence in one or more of these pigments. The symptoms of color blindness include difficulty distinguishing reds and greens, which is most common, difficulty determining blues and greens, which is less common. Complete color blindness is very rare, and students will see these colors in shades of gray. Impacts on learning include a student's inability to identify significant colors, such as the red indicator on mechanical safeties, the color of certain game species, such as the wild turkey, and possibly game signs, such as blood trails. Additionally, color-coded classroom props will not be distinguishable by these students. Accommodations for these students include using distinguishable colors, pointing out areas of concern to these students, such as checking the owner's manual for information on the location and use of mechanical safeties, or that students may require help when blood trailing game. Something else to think about is how these students perceive the color fluorescent orange while in the field. Nearsightedness, or myopia. Nearsightedness is caused when the cornea is steeper or the eye is longer than the normal eye. Light entering the eye focuses in front of the cornea instead of directly on it. This progressively gets worse through adolescence but stabilizes in early adulthood. Symptoms include distant objects may appear blurry, and students may have to squint to focus on these distant objects. Impacts on learning may include students being unable to see objects in the classroom with or without corrective lenses. Accommodations for these students may include the use of large letters on blackboards or flip charts, again using distinguishable colors, positioning these students closer to the front of the classroom, notifying students ahead of the class that the student manual has a read aloud capability, and that the students can, if they so desire, obtain a copy of the manual prior to class so that they can read through it and be prepared. Farsightedness, or hyperopia, occurs when the cornea is flatter or the eye is shorter than the normal eye. Light entering the eye focuses behind the retina instead of directly on it. Students with this condition have difficulty seeing things up close and get eye fatigue when reading. Impacts on learning include difficulty reading exams and/or study materials. Accommodations for these students include the use of large letters on blackboards and flip charts, the use of distinguishable colors, positioning in the classroom, and reading exams to the students. Blindness is not always a complete loss of vision. Extremely poor vision even with corrective lenses. Legally, worse than 2200 vision with corrective lenses. Some of the causes may include disease, abnormalities or injuries, or genetic defects to the eye, and in some cases poisoning. Symptoms include no sight at all, or poor visual acuity, or even restricted field of view. This will impact all exercises, activities, and hands-on events during classes. Accommodations for these students may include a helper in the class, reading the exams out loud to the students, providing the students with study material ahead of time so they may prepare for the class. Hearing difficulties. Hearing difficulties can be listed in two categories. Hearing impairment, which is an impairment either permanent or fluctuating that adversely affects educational performance, or hearing loss, an impairment so severe that processing linguistic information through hearing with or without amplification is impaired. Sound is measured by its loudness, called intensity, and by its frequency, or pitch. Impairments can occur in either or both areas, in one ear or both. Generally, hearing loss is categorized as one of three types. Conductive hearing loss, which is caused by disease or obstructions in the outer or middle ear. It affects all frequencies of hearing evenly, but does not result in a severe hearing loss. Impacts on learning are the inability to properly hear instructions, comments, and classroom discussions. These students usually have hearing aids, but may need to be repositioned in the classroom. Sensory neural hearing loss, caused by damage to the hair cells of the inner ear or nerves supplying them, affects certain frequencies more than others, and perceived sound is distorted. The impacts on learning are the same as before. Accommodations, students, again, may be wearing hearing aids to accommodate, or may need to be repositioned in the class to understand content better. Mixed hearing loss basically is a combination of both conductive and sensorineural loss. The symptoms can be a combination of either symptoms, one being more magnified than the other. Impacts on learning and accommodations are the same as previously discussed. Since English is an auditory language, the majority of people born with total or severe hearing loss are unable to read or comprehend written text. Those that can are functioning at a significantly lower level than their peers. Those students with complete hearing loss can be provided with the written materials ahead of time or directed to the Hearing Impaired web course, which is sign language translated, narrated for helpers, and highlighted to allow assistants to follow along with the content. You may allow parent or companion to attend and assist during the training, or, if necessary, provide sign language interpreter for the student as per Hunter-Trapper Education Policy 2.3 Hearing Impaired. Please note, however, ensure the student and the interpreter and the student use the same sign language. Movement or tactile impairments. There are many different types of these impairments. Some of the more common ones you may run across as an instructor include cerebral palsy, spina bifida, or degraded or loss of limb use due to accidents, injuries, or disease. Cerebral palsy is not a disorder with a single cause. It's a group of disorders with similar problems in control of movement. Usually results from some sort of brain injury, either before birth or after birth. These can include some sort of brain infection, brain injury during the birthing process, or the result of a head injury, most often from motor vehicle accidents, falls, early in infancy. Spina bifida is a birth defect that involves the incomplete development of the spinal cord or its coverings. Some symptoms of students with cerebral palsy include a lack of muscle coordination when performing voluntary movements, or stiff muscles and exaggerated reflexes, walking with one foot or leg dragging, walking on the toes, a crouched gait, or a scissored gait, and muscle tone that is either too stiff or too floppy. Some of the symptoms of spina bifida include some sort of paralysis. Additionally, students with spina bifida also experience some sort of bowel or bladder control issues. Some may have attention deficit hyperactivity disorder, ADHD, or other learning difficulties such as hand-eye coordination problems. Students with these conditions may have difficulty with performing certain skill activities in class, maneuvering through the class, and taking the written exam. Accommodations for these students should include adequate handicap accessible restrooms, parking facilities. The classroom should be arranged so that it will allow them to have unobstructed movement. And during the written exams and/or skill events, parents or an assistant should be able to help the student complete the tasks. Please note, these students are aware of their condition and understand that they will probably not be hunting or trapping by themselves, that they will always have a companion with them, determinant on their level of impairment. Cognitive neurological conditions. These are conditions that affect a student's ability to to process information as a result of cerebral abnormalities. These conditions include Tourette Syndrome, ADHD, Attention Deficit Hyperactivity Disorder, CAPD, Central Auditory Processing Disorder, and Dyslexia. Tourette Syndrome. It is a neurological disorder identified by repetitive involuntary movements and vocalizations called tics. Not all vocalizations are profane, and it is often intensified when excited or anxious. It is most frequent in males. The causes are unknown, but does seem to focus on abnormalities in certain brain regions. It may also be an inherited disorder. Some student behaviors you may encounter include motor tics, which are things such as eye blinking, facial grimacing, shoulder shrugging, head or shoulder jerking, punching oneself, which is very rare, and vocal tics, repetitive throat clearing, sniffing, or grunting sounds, repeating words or phrases. Instructors should exercise patience. These students are not deliberately attempting to disrupt your class. Do not draw attention to them, but merely, during a break, pull them aside and confirm what their condition is, and possibly have their companion sit with them. You may have to move the student to another area of the classroom to prevent more disruption within the classroom. Attention Deficit Hyperactivity Disorder, ADHD. It is a condition where a person finds difficulty controlling their behavior or paying attention. All children are restless, daydream, or act impulsively, but not all children have ADHD. As far as causes, there are many theories but very few conclusions. They may be caused by environment or genetics. Possible student behaviors include consistently inattentive, hyperactive, consistently impulsive, a combination of these characteristics. Students with ADHD can impact your class in the following ways. They may distract others from learning, be mistaken as a disciplinary problem, place extra stress on the instructors, thus influencing instruction, and may cause possible safety concerns. Some strategies on dealing with students with ADHD include instructor tolerance and patience, stay on task with lesson plans, have a separate testing area for these students where you can read the exam and or allow oral responses, do not time the test, or present these students with a schedule of the course beforehand. Central Auditory Processing Disorder, CAPD. Students have difficulty discriminating sounds from speech and or recognizing, remembering, or understanding presented information. The causes include damage or impairment to the nerves of the central nervous system, either in the pathways to the brain or in the brain itself. Possible student behaviors include inconsistent response to speech, stating what, huh, difficulty in paying attention in noisy environments, misunderstanding what is said by the instructors and class, difficulty in following long instructions. Some strategies used to accommodate these students can include eliminating or reducing the source of any background noise in the classroom, using a PA system or microphone with speakers when possible, position these students near the front of the class, speak at a slower, clearer, and more consistent rate, allow students to record the instruction, and have a separate testing area for these students. Dyslexia is not a disorder where the person sees words or letters backwards. Dyslexia is a specific learning difficulty affecting the ability of students to deal with text and often numbers. It occurs 3 times more often in males than in females. There are 2 types of dyslexia: acquired, which is the result from temporary hearing problems such as ear infections during early childhood, and developmental. The cause is not fully understood. However, neurological abnormalities in the brain are evident. Possible student behaviors include problems reading, writing, and spelling, difficulty with text, memory, or some sequence processing. They may have self-esteem issues. Never select a known dyslexic student to read aloud during the course. Hunter education students with dyslexia can be accommodated in class by using some of these simple strategies. Provide oral testing or untimed test. Do not force any oral reading. Allow the students to dictate test answers. Reduce the amount of copying tasks such as filling in worksheets. Place these students in the front of the class. Print. Don't use cursive when writing on the chalkboard or on easels. Before we end this unit, there are 2 things that must be covered. The first is that some of these students may need to take medication during a Hunter education course. Do not deny anyone their need for medication. These students or their parents will probably let you know when they arrive. And finally, when you learn that a student with a condition or disorder will be coming to one of your classes, do a little research beforehand so you're not caught off guard.